Talk. You ready?
I'm ready.
Here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine Rehab. Buckeye PMR.com is the website. I'm here today with Ann. What's up, Ann? We're not going to use your last name.
All right.
Yeah.
I'm doing great. How are you, Buzz?
Doing good. But anyways, we're going to talk to Ann today about hormone replacement therapy for females. She's been with us for a couple of months now. She's going to kind of tell you about her experience and how she's liking it. So we're going to cut the break and be right back.
Yeah, I forgot to tell you. Yeah, we don't use last names. Is it A-N-N-E or A-N-N? A-N-N. Okay. Just stay real close to the microphone and you'll be fine. Ready?
If I lose my voice, you have to do the whole show.
Here we go.
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab. BuckeyePMR.com is the website. And I'm here today with Ann. What's going on, Ann?
I'm doing great.
Ann shy. Actually, not really. She's blushing.
I am blushing, and I've been blushing for a couple of months now.
Yes. So, anyways, Ann is a female. How old are you, Ann?
I'm 62.
And she's been doing hormones with us for how long?
2 months.
Okay. Mm-hmm. And maybe tell us a little bit about your past. We've already kind of hashed through this before the show.
Mm-hmm.
We've had a good time anyways. But so tell us what happened. You were having some problems.
I was diagnosed by my primary care physician with a couple of compression fractures in my spine, and I'd previously had a couple of wrist fractures, and she diagnosed me as having osteoporosis. And in looking for treatments for osteoporosis, I noticed one unusual thing that I'd never heard of before, and that was testosterone replacement, which can actually regenerate your bones.
And how long, when were you diagnosed with osteoporosis or osteopenia?
November, osteopenia several years ago, osteoporosis last November.
So they told you, so you knew you had osteopenia for some time. Did they give you any solutions for that at that
No.
point? So they just basically said your bones are getting weaker, you're
Correct.
getting older.
That's what happens when you get older.
No solutions to that. And then you actually fractured your back.
Mm-hmm.
Did you do something? Were you lifting something or just
I
happened?
have no idea. I think I fell.
Okay.
Looking back, I think I fell and did it.
And where were the fractures? Like your mid-back area?
T8 through T11.
That's like between your shoulder blades then. So you actually fell and broke some bones in your back.
Mm-hmm.
The bones were that thin.
Mm-hmm.
And when you went to your doctor, what did they say? What was the solution to that?
They said I could take some IV medication once or twice a year, and that might slow the degeneration of my bones.
Wow. Okay. And you had fractured your wrist also
Both
due to the
wrists.
osteopenia. What did you fall with that incident
Yes,
too?
two falls.
So, so you start doing your own research, and that's kind of the cool thing about society today. I always tell, I do lectures all the time, and we have the radio show, obviously. And anything we talk about on the radio show or when I do my lectures, the cool thing is you can go online and do your own research. And that's something that
you're obligated to do that.
Yeah, I mean, you're responsible for your own health, and that's something we didn't have an option even 10 years ago. You couldn't go online and look for stuff. So I always tell people, listen to the radio show, go to my talks, but check the stuff out yourself, and
Right.
fact check it yourself, type of thing. So you were messing around online, and you heard about testosterone, but you never, and how it could possibly help bone loss. And you had a kind of a cool story. You went on vacation.
Went on vacation and was on my Kindle account while I was on vacation, and noticed that my daughter-in-law had added a book on our Kindle account called The Secret Female Hormone: How Testosterone Replacement Can Change Your Life. I read it from cover to cover, and it changed my life.
And what did that book say?
The book is...
That's kind of weird timing, too, because how did you hear about testosterone? How did you hear about it in the first place?
I was looking online for treatments for osteoporosis.
Google search.
And the book seemed like it was written for me. It's a very detailed research about the different hormones for females and the difference between men and women, and the effects of hormone replacement, all the different types of hormone replacement, how to decide which one is the right one for you, and etc. So I contacted...
And you were in Australia.
I was in Australia. Jeez. And while I was there, I emailed Buckeye PMR. And they said, call as soon as you get back, and we'll schedule you an appointment.
So we actually got a patient from Australia. That's awesome.
Yes,
nice.
you did. Yeah.
Internet works.
Came back, went through the process, and...
Maybe talk about the process, too, because I think a lot of people listen to the show, and they just don't take that step. They think it's going to be too complicated. Like, how hard was it? It
was very easy. I called, and they scheduled me an appointment to come in for a first meeting, which I was able to get in fairly quickly and went through a very detailed information session with a person one-on-one and talked about what your program does and what to expect and the goods and the bads, and then had blood drawn on that first appointment. A week later, came back to review the results of the lab work, and as I suspected, I was very deficient in testosterone, progesterone, estrogen, and DHEA.
And those are the key female hormones.
Mm-hmm.
Yeah.
And we made a plan to treat those deficiencies. A week later, I came back. They had sent my information to the compounding pharmacy, and a week later, I came back, had received the medicines from the compounding pharmacy, and began to take orally progesterone and DHA each day, and a cream for estrogen rubbed on my thigh each day, and I had a testosterone pellet implanted in my hip.
Yeah, I think, and just so people know, that pellet's about the size of a piece of rice.
Very small, very easy process. Lay flat on a massage table. It's inserted very quickly.
Did it hurt?
No, it didn't hurt. And you go home.
Yeah, and you had mentioned a compounding pharmacy, just for people listening if they don't know what that is. So when you come to Buckeye, all the medications, we only use bioidenticals, which basically means the medications we give are identical to what your body used to produce. Nothing synthetic, and those are made at a compounding pharmacy. And a compounding pharmacy is different than a big corporate pharmacy because everything is custom made. So, Dr. Bainin, who has her diplomate in anti-aging, will go through the blood work, and she'll come up with a custom protocol for each person. And every person gets a different dosage. There's no cookie cutter on this thing. Mm-hmm. So, and then she'll let the compounding pharmacy know, and they actually literally make the medication for you. And so instead of buying a bottle that everyone would take, your estrogen cream, your testosterone pellet, those are custom made. And they ship them right to your house.
Right. They shipped it to my house, and then I brought it to the appointment and was given detailed instructions on how to do everything, and had the pellet inserted on a Wednesday, and off home I went.
Okay. And then when did you start to notice a difference?
About 5 days later, and I'm sort of hesitant to say this was so quick because I don't want people to think it's automatically quick like that, but after 5 days, I had an entirely new me, which was shocking to me and even more shocking to my husband.
Like what happened? Like what? Did you just wake up one day and say, "I just feel different today," or would you?
Pretty much like that. It was on a Sunday, and all of a sudden, my body felt like it hadn't felt in a very, very, very long time. And it was a very happy feeling, very good feeling for me, and my husband was very shocked at.
Would you wake him up and say, "Hey, honey, I'm ready to go"?
I said, "Get your clothes off and get in here." And he asked for my ID. Because he was not
How
quite
many years
sure.
been married for? How many years?
42.
Yeah, that's awesome. That's awesome. But in those results, we thought your results are quicker than most. Usually, it takes 8 to 10 weeks, but I suspect you must have been very deficient, and just getting those hormones back into your body.
I was.
You can't turn back the clock of time, but there's no reason you can't feel like you're 25 or 30 again.
My husband and I have sat together on a number of occasions and said, "What have we missed? What have we missed?" Here we are both in our early 60s, and we have missed out on this because we didn't know about it. Yeah. And, he's very quick to say, "Well, we go forward from here." Mm-hmm. But still, we could have had a much more fulfilling relationship long before now if we had known.
Right. And unfortunately, what happens is people mistake bioidentical hormones, which you don't really hear about, because these bioidenticals that we use at Buckeye, they're only made by compounding pharmacies. And the reason for that is big pharma can't make any money. You can't patent a bioidentical. So the estrogen you're taking and the progesterone you're taking and the testosterone you're taking, because it's identical to what your body produces, it's not synthetic, you can't patent it, so there's no money in it. So what Big Pharma has done, unfortunately, is when a female like yourself, starts to have osteoporosis, instead of giving you testosterone and estrogen to make your bones strong again, they have Fosamax and they have Premarin, they have Probera. These are all drugs that mimic hormones, but they're not hormones. And Premarin's the one I harp on all the time. Premarin, which, did you ever take Premarin?
No, I've never done any hormone replacement before this.
And a lot of females don't because they assume it's bad and it causes cancer.
Well, that wasn't my thing. I just didn't think I needed it, and I was proud of not being able to, not having to take it.
Right. Yeah. And once a female hits menopause, that's when we talk about, guys decrease right around the age 30. Usually is when you start 3 to 5% a year. So it's real slow. And a lot of times they don't even know they're deficient until you ask a guy. Because you ask a guy, hey, how do you feel? Guys are telling, I feel fine. Well, how do you feel now? How's your libido? How's your aches and pains? How do you sleep now compared to when you were 25? Oh, well, nowhere near as good. Well, that's where you're supposed to be. And females, usually what happens with you guys is once you hit menopause is lack of hormones. Quit producing estrogen, quit producing testosterone, you fall off a cliff.
Right.
And it's sad that females just suffer through that.
And that's what your doctor normally tells you to do. Well, this is a result of aging. This is what happens as you age. And my experience has been, yes, it happened. And I had zero libido, and I had a mediocre life and took lots of antidepressants.
When did you start taking those?
I've been taking antidepressants for about 25 years.
Was it right around that time, though? And
yes.
we talk about that on the show all the time, too. Guys and girls, when you are hormone deficient, if you look up the symptoms of depression compared to the symptoms of low testosterone, they're mirror images of each other. So what happens, unfortunately, to people is they'll go to the doctor and say, hey, I'm tired and I have a libido, I just don't have energy. And they'll say, well, could it be my hormones? And the doctor's like, no, it's probably depression. Let's just start out with some antidepressants and see how that goes. And the antidepressants mess up your hormones even worse. And, and we know with all these school shootings and stuff, there's lots of side effects to taking antidepressants. I mean, one of the side effects of antidepressants is suicide. And not saying that some people don't need antidepressants. I'm not here to say it, but they're way, 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 way overprescribed.
Well, I would not have thought that during all that time that I was taking them, but now that things have changed in my body, I am weaning myself off of that.
Yeah, you got to wean yourself off that, so you can't come up. Yeah.
Right, and I can see that I'm going to be able to eliminate it in the near future. I'm also taking, at the recommendation of the staff, supplements for vitamin D too, and I think that has helped as well.
Yeah, I mean, pretty much anyone in Ohio, we have thousands of patients at this point. I've never seen someone who doesn't supplement with vitamin D have a proper vitamin D level. So if you live in Ohio, I don't care if you work outside, or you're a golfer, you're a landscaper, you still need vitamin D because the sun's just not strong enough here. And vitamin D is indicated in anti-cancer, anti-aging. It's so inexpensive, you'd be crazy enough to take it. What's it cost? 10 cents a day? I don't even know. Everyone's got to take vitamin D, but kind of circling back to the hormone thing, is a lot of females, you go through that menopause thing, you start having depression, hot flashes, all this stuff, and they say, well, we can put you on Premarin, and you get the Premarin and you realize all the side effects it causes cancer and all this different stuff. And a lot of females are just like, I guess I'm just going to get old, and this is just what it is. It is what it is.
Exactly.
And it doesn't have to be.
It does not have to be.
It doesn't have to be. That's why, that we do the radio show, and I tell everyone, you're crazy, literally crazy, not to get your blood work done if you're having these symptoms. Because if you are suffering with, lack of energy, poor sleep patterns, low libido, you don't have to.
No, you don't. And it has taken everything in me not to just go to total strangers and say, are you happy with the way you feel right now? Because the change is so dramatic. I just want everybody who is in the same situation that I was in, which I think was probably a pretty normal situation for a mature woman, that it does not have to be boring, and it's just okay. It's okay to take that step and make huge improvements in your life, amazing improvements.
Yeah. And on top of the things, I mean, you literally were getting fractures, and people, we treat a lot of people with degenerative knee conditions and back conditions in our office, obviously. The reason you break down with age is because of your hormones. So, and obviously we do a lot of stem cell procedures and other things to fix things, but if you don't have hormones, if you don't have testosterone, if you don't have estrogen, your growth hormone's not where it's supposed to be, I don't care what kind of physical therapy, chiropractic, medical stuff you do, you're just going to wear out because your hormones are how your cells communicate. And a lot of people don't realize that. Your hormones, your estrogen, your testosterone is how your cells communicate with each other. That's how they know to build stronger bones, build stronger muscles. If you don't have those, they can't communicate. And that's why you get old and die.
I don't think that my primary care physicians over the years have purposefully not given me these solutions. I think they just don't know about it. And I think that as time goes on, it will be more common, and the word will get out that there are better treatments than what are currently being used. But you have to kind of take responsibility for that yourself right now. Unfortunately, a lot of times insurance doesn't cover the whole thing right now because it's not considered a medical necessity. But for me, I consider this to be a medical necessity. It's dramatically changed my whole attitude. People say, well, do you feel? How do you feel? The only thing that the word that I use to say, how do I feel so much happier.
That's awesome. That's what life's all about. What else is there?
It is. It absolutely is. So I'm a strong advocate.
Yeah. So, and back to kind of the primary cares. Primary care physicians aren't bad, and I never want to oppose them as being bad on the show because they're not.
No.
But a primary care physician is really just a portal of entry. When you go there with a runny nose or something's bleeding, they have to basically their job is to figure out what it is and send you to the proper person. I mean, they can't be experts in everything. It is what it is. And another thing a lot of people don't realize is, as a physician, the only education you get once you graduate medical school, and really the majority of what you learn in medical school is taught by the pharmaceutical companies. So they take you to lunch, they take you on vacations, and of course they're going to talk about their medications. They're not going to talk about bioidenticals or stem cells, things that you can't patent.
Right.
They're going to talk about drugs that make money. And that's what's really messed up with healthcare if you think about it. Now, as a caveat to that, because of the internet and because of books like this here, you can self-educate yourself for sure. And and I strongly recommend everyone, if you've been listening to the show and you're thinking about getting on hormones, but then what I hear often is that someone will come to my office, hey, listen, my doc said don't do this, it's bad for you, or it drives me crazy. You have guys who go, I have a history of heart conditions, I can't take testosterone. That's more reason to take testosterone.
Yeah. Right.
If you got a heart condition, you should be on testosterone. You're crazy not to be.
Right.
It doesn't cause heart disease.
Well, I did reach out to my primary care doctor before to see if this is something she had heard of, if she would be willing to research it, but they just don't have the information.
They don't have the time.
They don't have the time, and it's not one of the tools they have in their boxes right now. And it probably would take some effort for them to expand into that. So I didn't stop there.
All right, we have to cut the break real quick, but we're going to come back and talk a little bit more about bioidentical hormone replacement. So we're going to cut the break, and we'll be right back.
You got about 8 more minutes. I thought you were going to say hey, if testosterone was bad for your heart, then every teenage boy would have a bad heart.
That's true. That's what my husband keeps telling me. You're like a 25-year-old man.
Yeah,
I finally have
you're
a
a guy
buddy
in your teens and 20s, your body is just gushing with
and
testosterone.
the E3 we're talking about, you have to be a gel. That's anti-cancer. That's why you have to have it. Very important. And I don't think you can get that as a pellet. I'll research that for you, but I'm pretty sure it has to be gel.
I think there's a lot of misinformation about hormones. Causing cancer, causing this.
I told my primary care physician, I told her, I said, I'm going to start this last fall. I said, got the blood work back. And this doctor is one of the clients of the radio station. He's got a lot of patients who do this. And she said, well, let me know how that goes for you. And I did let her know, earlier this year when I was in talking to her about digestive problems I was having, she said, how's the hormone replacement therapy going? I go, it's awesome. I'm not waking up 7 or 6 or 7, 8 times a night. I'm waking up about once or twice a night, usually about twice a night. And she said, that's good, and I'm getting a more restful sleep, and it's helping in other ways. She said, that's fantastic. I love it.
Well, I think most people that actually start
and she didn't
on
badmouth it when I told her I was going to do it.
Cool.
Could care less about getting a good night's sleep. or
That's
building
better
bones.
for your overall health.
Oh yeah,
If you have a
we're
restful
worried about
sleep.
something else. We're worried about something else.
Yes.
Oh yeah, but
Yeah.
if you get a more restful sleep, that's good for
Not very good.
your overall health.
I'm telling you, your overall health is much better when you're having sex a lot.
It's cardio.
No, I know that.
Yeah.
I know that. I've got a few old girlfriends who could. Yeah, they could. Yeah.
All right, let's go back. Let's go. Come on,
He's a sex maniac. Yeah, of course. And everybody knows that. If they don't know that, then they're stupid.
Well, everybody knows it, but nobody says it.
Yeah. See, I'll say it. I'll say it on Facebook too. I don't care. All right, we ready to roll?
Yeah, we're ready.
All right.
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine Rehab. BuckeyePMR.com is the website. We were here talking about bioidentical hormone replacement therapy, and we're talking a little bit about how a lot of people, we talk about this stuff on the show, and and people think that if it was that good, wouldn't my primary care tell me about it? And I was explaining the reason they don't tell you about it is, number one, they don't have the ability to really order from a compounding pharmacy, and the other thing with bioidenticals is they're very safe. There's no side effects because you're simply replacing what your body used to produce. But it does require a level of management of your case. We have to do blood works on you. We usually do one at 4 weeks and then every 20 weeks to manage and make sure we dose your hormones properly. And that's something that a primary care just wouldn't be able to do. Mm-hmm. So it's much easier to put you on an antidepressant because there's no management to that. But hormones do require a level of management. So that's a reason I think that it would never really fit a traditional medical practice and why you should see a specialist because, I see the other extreme. I see people that are going to places. There's a place in town where for guys, they don't even treat girls, where guys go there and they can go every other week and get a testosterone shot. Well, that's completely unhealthy because a shot lasts a week. So they're yo-yoing their system. It makes no sense. Or their doctor has them on testosterone. They're not managing their estrogen levels. Like if you're on testosterone, estrogen has to be managed, period. It's dangerous if it's not. So, and these are all things that I think that's why you have to go to a specialist. So, if someone's listened to the show, you pretty much said that you missed out. This cost you some time. You're feeling much better now.
Yes, I am.
Husband's very happy now.
Yes, my husband is thrilled.
Happy husband, happy family.
Yes.
Yes.
Yeah.
So, if someone's listening, what's your advice? Like, so. And what happens, people listen to the show week after week, and I think they think about calling, but then they end up going to their general practitioner. Their general practitioner's like, you probably don't need that. Or they'll test them and say, you're fine for your age.
Right.
Who wants to be fine for your age? What the hell is that?
That's the clincher right there, is you accept the fact that you're aging, and so all of these things are going to happen when you age. Your bones get weak, your libido drops, your mood changes, and I am here to say that can be reversed, and I only wish that I had done it 20 years ago instead of now, because the change has been dramatic for me, and I expect that it will get better because I know just in 2 months' time my bones have not had a chance to regenerate, my muscles have not had the chance yet to regenerate. I had been having some urinary incontinence. I had very large babies, and I do feel like, even though it's only been 2 months, I feel like my pelvic floor has tightened back up, and I'm not having that problem as much, or if at all, as I was. So there are lots of different things that I'm still experiencing new all the time. But it's very exciting, and I do feel like it has made my life much more worth living than it was 2 months ago.
That's awesome. I'm really happy for you. And I just hope anyone listening here, if you're hormone deficient, which you won't know unless you get your blood work tested by someone who really specializes in it, and you replace those hormones, there's no reason everyone can't feel like they're 25 or 30 again.
I'm a normal person. I'm a normal person who's been married for 42 years, and I'm in my early 60s, and I'm plump, and all these things can happen for you if you just take that initial first step. And I was hesitant to do it, and I was nervous about doing it, but after I read
Yeah, what's that book again? Just so
It's
people have
called
it.
The Secret Female Hormone, How Testosterone Replacement Can Change Your Life. And it's written by a medical doctor, Kathy Maupin.
Okay.
And I got it on Amazon. But it's very detailed and explains in great detail the whole process and the reasons and what you could expect if you
That's
do it
awesome.
or if you don't do it.
So check that book out. There's lots of good books out there, but that sounds like it's a really good one that made you make the step. And you can always go to our website, which is BuckeyePMR.com. We have a lot of articles on there too. But as I always say, if you're sitting listening and you're low libido, difficulty sleeping, aches and pains, or bones getting thinner, as a male or a female, step one is get your blood work done. It's real simple. Usually your insurance covers it. If not, it's not that expensive. Call the office. We draw the blood right in the office. We can explain exactly how the program works. And the blood work never lies. If you need it, we'll replace it. If you don't, we won't. It's that simple. So you have nothing to lose.
I think that was one of the best parts of the process is your first appointment, you get a lot of information and you get your blood drawn. And it's not just hormone levels that they're looking for. You get a full panel of blood work done. So you're learning about your cholesterol, your gastric enzymes, your all those, everything. It's a full workup of blood so that you can see and they can see if your hormone replacement really would be appropriate based on your general health. And there's no pressure at that meeting. You leave with information, you come back, and your blood work is offered to you. You leave with a copy of your blood work, and you make your own decision. And I never felt that there was pressure from anyone to do anything. It was all based on what my lab results were.
Awesome. Well, thanks so much for sharing your story. Hopefully you can motivate some people to make that change in their life. I see so often the females come in and they're suffering and they have, they come to us because they have knee pain or back pain. And I'm like, are you on hormones? They're like, no. I'm like, well, step one, you got to fix that, because if you don't fix it, it's a downhill slope the rest of your life. And who wants to?
Right.
You don't have to be downhill. You can be uphill.
Right.
You're on the uphill slope.
I am on the uphill slope, that's for sure.
Well, thanks so much for coming on. This
You're
is Dr.
welcome.
Buzz again with Buckeye Physical Medicine Rehab. BuckeyePMR.com's website. Check us out. And until next time.
And folks, hormone replacement therapy costs approximately the same as a cup of coffee every day. You know, that expensive coffee you buy at Starbucks.